And through computer-assisted planning, we can now precisely predict the amount of augmentation necessary to place our implant in the ideal position and the ideal width and the ideal trajectory. And all of this information will help us to classify what type of defect we're dealing with, because this will help us in turn choose the right approach and technique and material. As in this patient, with precise measurement of the width, height, and the position of the inferior alveolar nerve, we can start to predict and visualize the ideal block graft and its shape in our coronal plane. We start to look at its height and the relationship to the interseptal bone in the sagittal plane, and also the existing width and the amount to which we need to augment to in our axial plane. Similarly, we look at the donor side. We look at the width, height, position of the inferior alveolar nerve to assure that we have adequate bone that we can harvest. And in planning the block harvest, it's critical that we harvest a bone or a block that is shaped as close as possible to what the defect is. And this requires attention to the angle of the sagittal osteotomy. Because if we have a 0-degree osteotomy angle, we can obtain a more square-shaped block form. Whereas if we have about a 10-degree angle to our osteotomy, it provides us with a slightly more tapered block form. And with a 20-degree angle, we will obtain a highly tapered block form. And in this particular patient, being the fact that we have a fairly tapered defect, our intention is going to have to be to angulate our sagittal osteotomy angle sufficiently that we obtain a highly tapered block form. Hence, we have a very thin inferior border while we're maintaining a full width at the crest. Similarly, we'll have to consider the line angles at the proximal and the distal aspects and make sure that we angulate our osteotomies accordingly to mimic that shape. And finally, in the mediolateral direction, to make sure that we have adequately angulated to obtain a block form which mimics those line angles.